I am Dr. Nanda Rajneesh. I am practicing in Apollo Spectra as a laparoscopic surgeon and an onco surgeon. See, COVID-19 pandemic situation, as I said, it is a very dynamic situation, and there is a virus that can spread very fast. It can spread by air, it can spread by droplets and secretions and body fluids which drops here and there. And this is the reason we have to protect our patients when they come to us for elective surgery. So how do we make sure, let us say the individual is asymptomatic and he still may be having COVID infection, because as I said, sensitivity of this test is only 70%. A lot of asymptomatic carriers may be present. So we think and imagine that every patient is asymptomatic and he is positive. So in our setup, we do elective short stay surgeries, and every patient who comes into the hospital is screened at the entrance itself. That is one sterilization we do, and they are given hand wash. We check for the smell, we check for the pulse oximetry, and we also look for if they can smell spirit. That is what we are asking them to smell and find out. That is one level of screening we do as soon as they enter. Second thing that we are doing, we are actually requesting patients to come only with one relative as much as possible when they come for surgery, and he drops the patient in the post-operative ward, and the patient stays in the room. Earlier in the post-operative ward, after surgery and before surgery, they were allowed to go meet the patient, talk to them. We tell them, okay, you talk to them once before they go to the operation theatre itself, and after that, from the preparation time in the post-operative area, patient is prepared. So all the nursing staff are actually protecting themselves also, and they are also protecting patients with a good sterilization, because we know that this virus with a good hand wash, with the soap and with the spirit, it dies. We know that, okay, because most often the transfer of the virus is from the aerosol droplets, here and there the droplets falling, and also if you go very near to patient, that is within 2 feet distance, the coughing and exhaled air can contain this virus. This is the reason mask helps us. 50% of the protection comes by just wearing mask. So we insist every individual who is there wears mask. Okay, all our staff are wearing N95 mask most often, and then we take the patients to the operation theatre. Operation theatre type, based on the type of surgery we do, the protection keeps changing, actually the kind of protection we do. In laparoscopic surgery, the aerosol coming out, the smoke coming out, we have to suck that smokes. So that we do, and the staff are all wearing COVID sets, protecting from head to foot, even the eyes are protected, and the anesthetist also use the face guard, we call it. We use the face guard before giving anesthesia. They are also protected, and even patients are protected. Let us say if any of the staff is a symptomatic carrier, he should not be spreading the infection to the patient, isn't it? And so even patients are protected just by staff closing themselves or everywhere. They close their eyes, they close their mouths. There should not be any body fluid transfers. This, we do not have any study in the operation theatre on just COVID infection, but we do know that other viruses do spread in the similar pattern. So those protections we have already learned in the process, and we are just following those methods. We think every patient, every individual who comes in is COVID positive, and we have to protect everybody and everything from that patient to others, and even that patient has to be protected. So we are also using masks, we are washing our hands regularly, we are wearing gloves to touch the patients. When required, we are wearing the gowns or PPE kits whenever it is required to see our patients. So this is a protection that we are following. Sterilization technique that we are following is routine sterilization that we do for all the instruments. That is what we do, and it is always, we don't want to infect other patients with the instruments also, because we sterilize them. That is routine sterilization that we do for any surgery.